Hi, I'm Wendy, and this is Pajama Days. Pardon my bedhead. My hair is a little too long, and I'm getting it cut soon. But I don't fix hair these days, and I don't wear makeup these days. But I wear pajamas a lot. And I've been really struggling with fatigue today. Been trying to do a little task, and then sit down and put my feet up and rest a while. So I thought, that's all right, I can still talk. Last time I made a video, I was in the middle of my journey and I just sort of dropped off because it had been more than 20 minutes and I didn't want to make it really long. But in January of 2021, I started taking anastrozole, a hormone blocker, to stop the growth of estrogen in my body because the cancer that they had found in my breast was estrogen fed. So, excuse me, I never realized all the benefits of estrogen, until I started taking medicine to stop it. Estrogen is good for your heart. It's good for your mood. It does so many things. It balances out your emotions. And when it stopped, I had debilitating joint pain. I cried all the time. I was exhausted with fatigue. And I literally would cry on my way to school in the mornings because I was so tired. And I would get to the school and park and literally give myself a pep talk just to walk into the building. And if I had morning duty in the cafeteria is the total opposite end of the building where my classroom is. And when my cafeteria duty was over, I would start my journey to my classroom, and I would have to stop in somebody else's classroom and sit down and take a break to get to mine. But I managed. I muddled through it, and I was on an anastrozole for 15 months, I believe. And I changed oncologist. And one thing I will say, if you are diagnosed with any kind of medical issue and you don't really feel supported or communicated with enough by your doctor, advocate for yourself. It's okay to change doctors if you feel like your needs are not being met. And the doctor that I started out with wasn't a terrible doctor. He's very good at what he does, and a lot of people just love him. But if I called their office, nobody answered. I was put to a voicemail. Literally, nobody ever answered their phone in person. Even if you were changing an appointment, it was rolled over into a voicemail, and you had to wait for them to call you back. Almost every time I went for an appointment there, I had to wait around an hour to see him. And I understand that they're really busy. They are doing chemo on site, and whatever issue they run into throughout the day puts them behind on seeing their patients. So it's not that I don't understand. It's just that I have a job. I have a full-time job. I have responsibilities, and I don't have time to sit in an office and wait for an hour to be seen. And I didn't really feel like I should have to call and leave a message. They should at least have somebody answering the phone if you need to change an appointment. But I got really frustrated about a lot of little things and just decided to go a different route because I knew I was going to be on this journey for 5 years, and because that's how long I have to take this medicine. And so when I changed doctors, the second doctor I had, she's just a breath of fresh air, and I don't ever have to wait long to see her. She cares about the whole person, not just your cancer issue. She told me that I needed to take a break from the medicine that I was taking because it was crippling my hands. And again, some people take that and never have side effects. So if they're telling you you need to take it, don't say, "Oh no, I don't want that." Try it and see if you don't have side effects, because a lot of people don't have any. So she had me take a break. So I stopped taking a hormone blocker for 3 months. And then after that 3 months, I started a different hormone blocker. It's called letrozole. And I will say there is a marked difference in my body in comparison. And what I have noticed in the support group that I'm in on Facebook for other people who take hormone blockers is that a lot of people do better on the second one, whatever it is. Like, a lot of people start and have letrozole first, and they have a really difficult time, and they change to anastrozole, and it's better for them. I don't know why that is. It's just bizarre, but every person's different, and every person's experience is different. And I personally have done better on this second one. I still have fatigue. Some days it's worse than others. I still have hot flashes. The hot flashes seem a little worse on letrozole with me than they were on anastrozole. But, and it's been over 3 years and they haven't gone away. So it is what it is, and you just take it a day at a time, and you say, this is not going to be forever, and you just keep chugging along. So, somewhere along the way, when I was still seeing that first doctor, I got a phone call one day from an endocrinologist office. And I was so confused because no doctor that I had been to had mentioned anything about an endocrinologist. So I didn't know who had referred me. And I didn't keep that appointment because I didn't know why I had it in the first place. And I found out later, the next time I went to the oncologist, he was like, what did the endocrinologist say? And I was like, wait, what? Nobody told me I was supposed to go to an endocrinologist. I just got a phone call from them, and they wanted to set up an appointment, but I didn't know why, so I didn't make an appointment. So he said that he had referred me because I had taken one infusion about 6 or 7 months into my anastrozole journey. Had one infusion of Reclast. And that is because they had done a bone scan and they had said that I had osteoporosis. Reclast is a medicine that strengthens your bones. Hormone blockers wear down your bones. So I had that infusion of Reclast, and it's like, the experience is similar to going in and sitting down and having chemo put in your veins. You sit there for a period of time, 30 minutes, 45 minutes, an hour, whatever, and they administer this medicine. And then when you get home, about 12 hours later, I was sick with flu-like symptoms and fever. And that's a very common side effect for that. My doctor didn't tell me anything I needed to do before or during that, but the people in the support group told me, hydrate, hydrate, hydrate. Drink a lot of water before, drink a lot of water during, drink a lot of water. So apparently that helps some, but it didn't keep me from those flu-like symptoms and fever and all that. And I had sickness like that for several days, as if I had the flu. And the reason he had sent me to an endocrinologist is because the endocrinologist can give you different medicines than Reclast. There's something called Prolia that you can take once a month or a quarter or something like that, maybe twice a year, I don't know. It's more often than once a year. But the endocrinologist also told me that only endocrinologists are qualified to read bone scans, and that he was not sure I had osteoporosis. He wanted me to have another bone scan. Well, I had to wait several months because insurance will only cover that every 2 years or something like that. So when I went to my new oncologist, she said, when it's time for another one, we'll look at it again. And she said, don't worry, if you need to go take a different medicine for your bones, I can prescribe that for you. So I didn't have to see an endocrinologist too. So that was nice because I felt like I was having to go to a different kind of doctor all the time. And it's like once you get in this cycle of having to see a certain doctor and you have to ongoing for years, you just feel like you're always going to the doctor. So that was good news. Well, when I finally got another bone scan, they said, you don't have osteoporosis, you have osteopenia, and it's really at an expected rate in comparison to your age. So I don't know if I was misdiagnosed the first time with osteoporosis or if the reclassed strengthened my bones so that I no longer appeared to have osteoporosis. I do not know. But the main thing is to know to take things one day at a time and try not to let the big picture scare you. If you have issues with anything, side effects, anything at all, talk to your doctor. Make sure you have a doctor that is listening, and you can get through it, encouraging yourself. This is not forever. Yes, it's a long time, but it's a process. And a lot of things in life take a process. I can remember being in college part-time as a married adult, thinking I'm never going to get through with this. Like I'm in my 30s and I'm never going to get through with this. But trust the process. Do one thing, one task at a time, pace it out, and you'll eventually get there. And that's another thing, that experience, I kind of lean on that sometimes with, man, I've still got 2 more years of this medicine almost, and I'm tired of it. But I've got 3 years behind me, and I've got 3 years behind me with a positive outlook because I encourage myself. No, I don't get to get up and go do all the things I'd like to do. It just is what it is. I don't beat myself up about it. I tell myself this is not forever and it's going to get better. I just got to get through right now. And that's okay. So I'm going to leave you with that. I'm going to talk in the future about pampering yourself. Take time out to do things that you enjoy. I'll probably cook things from time to time because I like to eat. And one way I pamper myself is maybe to make something that I like, or maybe even to make something that my husband or my kids like. It's a joy to cook. And I don't cook real often like I used to, but if I've got time off, it's not a big deal to cook a meal or to make a treat like maybe some little pigs in a blanket, or my big thing I've been hooked on lately is 6-week Raisin Bran muffins. You make the batter and it's huge, and it takes a whole box of Raisin Bran and lots of flour and sugar and oil or butter and eggs and all that, and you mix it up, and because it's got buttermilk in it, it lasts for a long time. So you just use it, and as I use it down, I put what I have left in a smaller bowl every once in a while because it takes up so much room in the refrigerator. I don't like when I first make it because it's in this great big bowl. But I've been kind of addicted to those things. I don't eat a lot at one time, but I might eat a muffin as a snack in the middle of the day with some butter on it. Find ways to treat yourself to things you enjoy and take it slow. Put your feet up often and encourage yourself and say it's going to be okay. This is not going to be forever. So that's just another little piece of my journey. I love y'all bunches, and I hope you have a blessed day.